AP Media presents Fairhope Hospice Today, brought to you by Fairhope Hospice and Palliative Care, Fairfield Federal Savings and Loan, the Fairfield County Board of Developmental Disabilities, and the Frankie Smith Funeral Home.
Hi, and welcome to Fairhope Hospice Today. I'm Kristen Glazier, President and CEO at Fairhope Hospice and Palliative Care, and we are so happy that you're joining us today. We are here at the beautiful AIM Clinic. We've got some great guests with me today. We just really wanted to talk to you a little bit about what our AIM Clinic is, what palliative care is. We're so excited. We have been opened for is it going to be 2 years in August, September?
2 years in August.
Okay, so I'd like to take a second and have my guests introduce themselves, and then we'll get started with just some thoughts and ideas.
My name's Alicia Grillo. I'm one of the nurse practitioners here at the clinic, and I also serve as the director.
My name is Haley Hilliard. I am one of the nurse practitioners here at the clinic.
How long have you been with us with Fairhope?
4 years.
Okay, Alicia, you and I have been here a long time.
It's almost 9 in May.
Okay. So, Alicia, you have been a part of palliative for so long. You've seen a lot of changes, a lot of ups and downs, a lot of numbers. Here we are at the clinic. You were appointed director not too long ago.
About 6 months ago.
Yeah. And, how has that changed for you to go from strictly seeing patients to now being on the other side where you're getting your feet wet a little differently with the different things that need done here at the clinic?
Well, it's definitely a change and a learning experience for me. It's very exciting to see where our program is going because we have been able to reach out to so many more individuals who may not have been accepting of the concept of palliative care before the idea of coming to a clinic. Because sometimes it can be very looming to have somebody come to your home, or it makes you feel a different way about your healthcare when someone's coming to you. But when you're coming here, it is the way that we're all trained.
Right.
So it's great to be able to reach out to so many other people.
Do you think that some of the patients feel more normal? They're going through a chronic illness and a difficult time. Do you think they feel more normal coming here to the clinic like they would go to any other physician's appointment?
Yeah, I would think so. Prior to having the clinic, we didn't have the ability to see somebody in an office setting. So we were limited to only going to their home, and that can be invasive for some people. And this is, like Alicia said, more of a trained environment that most of us are brought up going to a doctor's office and seeing a physician there. So I think it helps normalize it a little bit.
Can you tell us, just give us a little idea of what your responsibilities are and what your day looks like?
Yeah, it varies depending on the week generally. I primarily see people here in the clinic 1 week, and then I also cover the hospital. We provide palliative consults there, so I'm generally floating between one or the other settings.
Do you like kind of that, so it doesn't stay routine all the time? You throw a little bit of different...
It mixes it up just enough. Yeah. So it's not every single day, seeing people in the office, or every single day being in the hospital, which can be taxing, but it changes it up, so it keeps it somewhat interesting.
All right. Well, let's talk a little bit about how things have changed for you guys and for here at the clinic. Let's just think about some highlights. We've been open almost 2 years, a year and a half. But what are some of the highlights? What's changed here at the clinic from the day we got the keys and the day we moved in? What kind of things do you feel like have really changed significantly?
Well, we are a constant work in progress to be able to improve not only our practice, but our building as well. We have a new concrete pad poured out in the front so that those who need ADA access, it's much easier to get in. And we're working on some building improvements also for our facilities and allowing for ease of access here in the building.
That's really important, and we do have to thank our friends Lloyd and Diane Helber. Yes. They just saw the importance of, after being here at the clinic, just visiting as we purchased the building. They said, I think we need a nice ramp and some different things. So we're thankful for them.
I would add on aesthetically, we have made huge improvements and strides from where the building was when we purchased it. So it is beautiful, and not for the lack of a lot of hard work on
absolutely.
Even just the administrative staff and volunteers coming in to help give it the scrub down it needed.
Yeah. A lot of days out in the sun painting inside and out, but that makes it worth it. When you put a little sweat equity into it, it makes you feel, and you guys work so hard here every day, so we wanted to make sure that you had a nice place to be.
They were out mowing grass yesterday.
There you go.
It is the season.
Yep.
Let's take a quick second and give the phone number for if somebody has questions about palliative care, if they just need to speak to somebody about palliative care. The number that you can call is 740-808-8039. If you make that one phone call, we can get you in the right direction for care. All right, so can we give in 2 minutes, a brief idea of what palliative is? For some of our new viewers, what exactly is palliative care?
You want me to take that?
Yeah.
I always start with palliative is not hospice. Sometimes people think palliative and hospice are the same thing. They are different. They have similar threads in which we both focus on, quality of life and trying to manage symptoms. Generally, our goals are different. Someone on palliative care is doing typically aggressive kinds of treatments and interventions, say a cancer patient that is doing chemo and radiation and surgery. Palliative care is oftentimes an added layer of support through that. So I always start with that because sometimes people think they're one and the same and maybe have certain feelings towards hospice or not. But palliative care is kind of a newer specialty of medicine in recent years that focuses on managing symptoms, oftentimes for people that have chronic or just advanced disease processes. So we see lots of different types of people, whether that's someone that has heart failure, a weak heart, or bad lungs, maybe really bad COPD. We see cancer patients, we see people that have maybe Parkinson's or even a dementia diagnosis. So things that often we can't cure, but we can manage as best as possible.
Okay, I love that. I think sometimes people don't understand what qualifies you for palliative, what qualifies you for hospice. So that's a great point. So let's talk a little bit about, we have the physical building here, but where are your palliative patients? Like, how do you see them? How do you get to them? What does that look like?
Can we take that one too?
Sure, she's ready.
So we obviously have the clinic. We see people here. If you are mobile, not homebound, able to come to a doctor's office, we can see you here in the clinic. We also have people that, because of their underlying illness, they physically are homebound. They can't get out of the home to come see a physician or provider. So we do have a home-based program as well, where one of our nurse practitioners will come see you at home. And then we also go to the hospital, as I mentioned, Fairfield Medical Center. We partner with them. We provide consults there, and as well as going to nursing facilities in the community here in the Lancaster, Fairfield County area, nursing homes and assisted livings. We partner with them as well. So
if you think about somebody that's in a nursing facility or an assisted living, they have doctors, nurses, aides there all the time. What would palliative's role be when you see those patients there?
Yep. I often say we're just an added layer of support.
Okay.
We're an extra set of eyes and ears, and we all of the providers here know the specialists and the providers in the community pretty well. We have good working relationships with them. So we're going to collaborate and coordinate with them if we're laying eyes on someone and notice that maybe they're going into another heart failure flare. And we're going to work diligently to try and prevent a hospitalization, put things in place, and coordinating with other providers to get those treatments in line.
Okay.
And I really think one of the things we should highlight is our providers take the time to spend with individuals to get to know them really well. So if I take a call on a weekend or off hours, I know that I can look through that person's chart and Haley is going to have the whole story written for us so that we can provide care throughout the continuum. And then we're also going to be able to recognize on those good days and then those really challenging days, where do we fall in the spectrum, and help to guide those individuals through the healthcare world.
That's key. I really think that's key because there are so many different pieces. When people are chronically ill, they have a lot of physicians, they have a lot of needs, there are just a lot of things. And I think what your team does very well, you help them pull all that together. We have a great social worker, you have great NPs, office staff, physicians. So I think that really is such an important piece of what you guys do, because you take the time, you bring things together, and that's got to give your patients a lot of comfort and just a lot of ease in knowing that they can make a phone call to you. So let's go ahead and give that number one more time. If you have any questions about palliative care at any level, please just give us a call at 740-808-8039. Stay tuned. It is so important for families to feel comfortable and safe when they call, because oftentimes that first phone call, even picking up the phone physically and just dialing that number, is very hard. You're asking for something that is a very difficult and private decision, and so we want everyone to feel comfortable and safe that you pick up that phone, you make that phone call, and let us just guide you and lead you where you want. And then you can make an informed decision about what's best for you and your family.
The Frankie Smith Funeral Home and Crematory in Lancaster and the Johnson Smith Funeral Home in Baltimore have a long and wonderful history of serving our community. Feel free to give us a call at 740-653-0652. Stop in and see us at either of our two locations, 405 North Columbus Street in Lancaster and 207 South Main Street in Baltimore. Respect for tradition, regard for change.
Welcome back to Fairhope Hospice today. We are here at the AIM Clinic on East Main Street, and it's been a great time for us to talk with our nurse practitioners, just really about understanding what palliative care is, talk a little bit about the services we provide in the community, and we're going to give you some more information as we go along. But we wanted to really take a second to introduce another nurse practitioner. This is Becky Tash. Welcome, Becky.
Hi.
So, Becky, how long have you been with Fairhope? Has it been 4 years?
It has been about 3 years, a little over 3 years.
Okay.
Yeah.
And your role is great, I think, because you've had a little taste of everything. You have had sort of a piece of obviously seeing patients at the clinic, being at the hospital with patients. The role that you have right now is you work a lot with our hospice patients to do what we call face-to-face, but to make sure that they still qualify for hospice.
Yeah.
And sometimes those patients don't qualify, and then they have to come back to palliative. So maybe they have had a terminal illness, maybe they've stabilized, they don't need hospice care anymore. So oftentimes do you see them coming back to palliative care?
Yeah, so my role is a little unique in that when I go to see a patient for this face-to-face visit, it's also called like a recertification visit. So when someone comes on hospice, it's with very specific criteria for the disease they have, and with the estimated prognosis of 6 months or less. Now that changes, and nobody knows the exact date or time, but when we're reaching the end of those 6 months, I go to see, hey, do we still think that? Are they still meeting that medical criteria? Do we still think that timeline kind of fits? And sometimes, I mean, most of the time it does, but sometimes we see a patient stabilize and or even improve a little bit, usually unexpectedly. And when that happens, we might discharge them or graduate them from hospice. And a lot of times they come back to palliative just so we can take care of those symptoms still, monitor for any disease progression where they might get back to the point where they need hospice again.
Yeah. Because I think, you know, initially that diagnosis, like you said, to be admitted to hospice has to be a terminal illness. So oftentimes I don't think it's like that the terminal illness goes away. It's just that it's stabilized, and for whatever reason. Now I do think there are times when a diagnosis maybe totally changes. Maybe someone has had not a terminal diagnosis, but an acute situation, they may get better. But the part that I love about your job is that when we move them back to palliative, then we can still keep eyes on them. So you're not just totally allowing that patient to kind of float off and go on their own. We're keeping them kind of close so that we can make sure, like you said, their symptoms are managed. And so, I mean, what do you think about that role? Because you get to see both sides of that, and how, you know, you kind of fell into this. You're in a perfect spot for us. You help hospice a lot, but also keep a handle on those palliative patients. I mean, what do you think about the role that you're in right now?
I feel really lucky to be in this role. It's kind of a unique role where I'm not doing as much of the prescribing and stuff, but I'm more monitoring the progression of the disease. But if we see, like you said, it is a terminal diagnosis or an acute situation, but maybe things have slowed down or stabilized for a time, and we say, you know, we think you could come off hospice until we see more of that decline. But it is kind of not more of an art, but you're balancing an art and a science of medicine, and specifically end-of-life medicine, where you want to make sure they're getting the services when and where they need them. And palliative can kind of pick up that ball when somebody comes off hospice to say, hey, we've got you, and we can manage these symptoms that hospice has been managing, but, you know, until you reach that critical or declining point again.
Yeah, it's sort of like,
it goes back to that continuum of care where we are working with people in one aspect, and then they may move to hospice, and then things might stabilize and they come back. So it really helps us, Becky's role really helps us on the palliative end to keep that balance and allow a good report and a good handoff to know what's happened when they weren't with us, when they're on a different program, and what their specific needs are coming back to us.
Yeah, it's just like we talked about earlier, where when someone is chronically ill or terminally ill, they have so many things, so many doctors, so many things to do. So I'm really thankful that you have that role in hospice together, where you can meet them, kind of gently hold them to whatever you know, wherever they need to fall, whether it's hospice or whether it's palliative. So I think your role is very important. So. All right, if you have any questions, again, we're going to give you that number one more time. It's 740-808-8039. If you have any questions, just give us a call. And Becky, thank you for joining us today.
Thank you for having me.
Stay tuned.
At Fairfield Federal, we believe true prosperity is shared. For 130 years, Fairfield Federal has invested in the community that built us. From supporting businesses that employ our neighbors, empowering the initiatives that strengthen our community, and serving generations of families, Fairfield Federal is proud to share this milestone of progress with our hometown. Fairfield Federal is your place for checking, savings, and home loans. Member FDIC, Equal Housing Lender, NMLS number 402612.
At Fairfield DD, our mission is to create a vibrant community where people can lead lives of greater independence and make meaningful contributions. Technology can help each of us accomplish things we didn't think were possible. That's why we created the Enabling Technology Lending Library, a free resource where you can try smart devices that promote independence and connection. Explore it all from home with our virtual tour. See what's possible and then borrow what you need. Visit fairfielddd.com/lending library and start your journey today.
Welcome back to Fairhope Hospice Today. I'm Kristen Glazier, President and CEO, and I have some special guests with me today. Thank you for continuing to join us on our show. We are at the beautiful AIM Clinic on East Main Street, and with me this afternoon I have Dr. Barbara Singer. Welcome.
Hello. I'm so delighted to be here.
And how long have you been with Fairhope? You were just talking about that before.
Yeah, exactly. Just over 15 years.
Okay. And you received a very well-deserved award at our Fairhope Celebrates Life event, the President's Leadership Award. Just thanking you for your vision for palliative and for your practices and really guiding and helping to make our palliative program really important in the community. So I want to make sure that our viewers knew that today.
Thank you, but actually I'm the one who's so honored to be able to work with all the wonderful people and under your directorship.
Thank you. We're glad you're here.
Thank you.
Hi.
Hello. I'm Nicole DeMaestri-Colacon. I'm one of the palliative care nurse practitioners here at Fairhope, and I have been at Fairhope going on 4 years now.
Okay.
Yes.
Wow.
Yes.
All right, so I want to talk a little bit about your role, and obviously your role. You're a little bit like we talked with Haley earlier about how she does a few different things. Not only sees patients here at the clinic, at the hospital for palliative consults, referrals, a lot of guidance, support to the physicians and the families, and then in some of the nursing facilities too. So
That's correct.
I want to talk about your goal and your mission when you do that. You know, one of the things that you really focus on is how can we keep our patients healthier longer. Can we talk a little bit about that?
Absolutely. So we have patients with many different conditions, but I'll start first with our patients who are perhaps newly diagnosed with cancer and their lives are turned upside down. The stress for them is phenomenal. So when we step in and go, we can make sure that your pain is bearable, we can help you breathe better, we can help you sleep, and we can help you deal with the stress and the anxiety and the changes that it takes in your life. Our patients who have other conditions, when a patient can breathe well, they're going to feel less anxious, they're going to feel more comfortable in their lives, and these are all factors that we know extend health. If a patient's losing weight, for example, we can help mitigate that or change that some. And those are some of the small ways, and we do so many other things to help our patients with maintaining their health. And I think that between us we have this wide body of very practical knowledge, as well as access to the medications and care that supports a patient who's on a journey seeking help with their breathing or their heart or their cancer treatment. These things really do allow them to stay strong and actively engaged in the treatments they're seeking, and what could be better than to be a part of that?
I think, you know, one thing that we talked about in one of the other segments is how difficult it is when you have a new diagnosis. You have many physicians, many appointments, prescriptions, things, all the things you're worried about. So I feel one of the things that you guys do very well is you kind of pull that all together. Can we talk a little bit about how important it is to have the coordination with the specialists, the pulmonologist, the cardiologist, the oncologist? I mean, like how, when you work with the patient, what is your goal and how do you make that happen for them?
Absolutely. So something actually recently I've been saying to patients, and I think that it is even making more sense in my mind, is that I'm able to slow things down. The time that I'm allowed to spend with patients is amazing, and it allows me to slow down the education process of what is actually the disease that's taking place for the patient, but slowing down the appointments, the specialist, what each specialist means and what their role is for the patient. We're allowed to talk about that in the whole picture. And patients are very appreciative that they have time to be able to process that information while they're in an appointment with us. And we're also able to provide not only support for the patient, but that support for their caregiver, their family as well. They're in these visits with the patients, and we're slowing it all down for them.
That's funny that you say that, because earlier in one of the other segments, Alicia said the same thing, that you guys have the ability just to take a second, lay it out for them, and really just help them to process and know what each next step it is. And so I think that's really, I think that's so important in what you guys do every day. So let's take a second and give you the phone number. So the phone number to call if you have any questions about palliative, what we do, how to get a referral, anything that you need to know, please just give us a call at 740-808-8039. I think right now we just want to really talk about not the heart of what you do, but a very important piece of what happens here at the clinic. And that really is to talk about symptom management. With a chronic illness, people have symptoms. How do we approach that? Well, how do you approach that as a physician?
What's getting in the way?
Okay.
What's getting in the way of their life, getting in the way of their treatment, getting in the way of their health goals and life goals. And there are so many parts to that. And the time that you just spoke of helps us address each component of that. What's really bothering you right now? What's making it hard for your family? Those are huge things. And symptom management is, what's your digestion like? What's your breathing like? What's your sleep like? What's your pain like? We have patients who are freshly out of surgeries or hospitalizations, very burdened with symptoms, and being able to resolve those helps them be the family members they want to be and stay at home and healthier rather than running to the emergency room for long sessions that can be addressed at home just as readily often. And our familiarity with those patients makes all of that a really readily accessible thing.
And they don't have to start over and tell you the story because you guys are already aware. But what happens then if you help manage one of those symptoms? The communication is there with their primary caregiver or their specialist, correct?
Absolutely, absolutely. And they communicate with us. If they see a problem when a patient's in for a treatment or an infusion, they will contact us in a jiffy and we are on it immediately. I think our patients get such good care because of that.
The relationships that we have built with the specialists in the community, they are one phone call away to us and vice versa.
I think what's really important too is the fact that they are obviously specialists in their fields, but so are you guys.
Absolutely.
The hospitalists, the physicians, they lean on you for support and guidance, how to handle particular things, and I think that is invaluable. And for that, just as the CEO and just someone that really believes in what you're doing, I think that's one of the very most important things. So if we have to think about, you touched on the fact if we can manage a symptom, we're going to keep them out of the ER, which can turn into an admission or a long night and set them back. How do we do that?
How we do that is one of us nurse practitioners is on call 24/7. So patients and family members can call our clinic number and they will, through a series of prompts, be able to speak with one of us. Sometimes it is just support and guidance and knowing that they're doing the right thing. Caregivers already have the instruction and know how to take care of patients. They should already have the tools available to them. And so we are just reassuring them that they are doing the right thing. They are caring for their loved ones the right way. Sometimes it might be a new symptom that has risen and we can address that over the phone as well and talk patients and caregivers through that. We can prescribe medications. We can help them with their symptom management.
I love that at night because I do believe that sometimes at night everything is scarier, I think. And so there's a symptom, there's something pops up, a change. They can call you, get reassurance, guidance, whether it needs to be addressed now, can it wait till the morning with their primary care physician or you? They can come into the clinic. So I think that piece is really, really special and important. Right. I think what people are wanting to know too are how are we, how do we get paid? How are we reimbursed, and what does that look like? So do either of you want to take that?
So how we get paid is typically patients, their health insurance covers us just like they're going to a primary care doctor visit. Sometimes there are co-pays attached to that, but at Fairhope, we never want anyone to not take our services based on a financial reason. So we want to know those things. We do have a financial assistance program. We want to know if that's a hindrance to care because we want to address that. We don't want anyone to not take our services because of that.
Thank you for that. And I think that's something that not a lot of people realize, but it is just like a copay that you may see when you see any other type of physician.
Exactly.
So, Dr. Singer, what makes you feel the most proud about this clinic and about your work every day?
When I see the difference in a patient's life and they're moving forward, and they would not have without our clinic's care. They would not have done a fraction of as well, and they might not have completed their therapy. Whatever they've chosen, when I see that, it is so rewarding and delightful, and I know that it fuels us.
Absolutely.
I think you guys are just so passionate about what you do, and I thank you every day for being in the trenches and helping our patients and our families. It's just invaluable. So
thank you.
We've talked a lot today about a lot of different things. Just to know that here at the AIM Clinic and with Fairhope, that our care is always patient-centered. We really focus on what the patient needs, what our families need. So if you have any questions, anything that we can do to help ease that burden, talk you through any situation that you might be in, please call us at 740-808-8039. Thank you guys for joining us today. I appreciate it.
Thank you.
And thank you for watching Fairhope Hospice Today.
IVP Media presents Fairhope Hospice Today. Brought to you by Fairhope Hospice and Palliative Care, Fairfield Federal Savings and Loan, the Fairfield County Board of Developmental Disabilities, and the Frankie Smith Funeral Home.